cardiovascular disease.
Cardiovascular disease.
Coronary artery disease.
Cardiovascular disease.
Heart disease or
Peripheral
fibrillation.
artery disease.
Cardiovascular
Cardiovascular disease. Heart disease is silent.
The blockages that I had were not the result of something I did the day before.
It can be prevented. My name is Jill Ferry, and I am a physician assistant practicing at Myrtue Medical Center. I'd like to talk to you a little bit about cardiovascular disease. Cardiovascular disease is still the #1 cause of death in both men and women in the United States. Most patients think it is cancer that causes it, but I am here to talk to you a little bit about risk factors associated with cardiovascular disease.
My name is Kurt Blatt, and I was sent to cardiac rehab after having pentupal bypass surgery and a little carotid clean out. Actually, my cardiac condition was kind of discovered by accident, and they said that I basically was a ticking time bomb, and had to have the cardiac surgery and the rehab that was associated with it, and everything just went super.
I think it's important for patients to realize that cardiovascular disease is a silent disease that develops over many years. This is something that just doesn't show up overnight.
These are long-term things that build up over time, so lifestyle and and stress and whatever else that leads to heart disease come on very, very gradually, and all of a sudden when they reach a certain point it becomes critical. And watching one's diet, as I was probably a few pounds overweight, and through this whole experience, right now I'm down about 97 pounds from what I was before, and that makes a big difference on the amount of energy the heart has to exude, so keeping one's weight down is a high priority item, and I'm kind of in the midst of trying to get that accomplished. Whether that happens or not remains to be seen, because I still like the chow, but I do watch my diet and watch some of the things that I consume now, and try to avoid the sugars and the fats in the diet, and make some adjustments along those lines.
Heart disease is really a silent disease until it manifests itself in our emergency room as a major cardiac event, such as a heart attack or stroke. Patients need to understand that with every lifestyle that they're doing, wrong or right, can either increase their risk of a cardiovascular event or decrease their risk. The biggest thing that I like to stress to my patients is taking care of yourself and coming in on a regular basis, and not ignoring subtle symptoms such as increased fatigue, such as difficulty doing tasks that were easy 6 months ago and now they're not.
It just went super. We were actually walking within 24 hours of cardiac surgery, so rehab is extremely important, and extremely important to me, and the things that it has provided and enabled me to do and stay a part of things that go on here at Harlan Community Schools. We got started, it was a difficult go. We started at extremely low levels and then set goals, and each time that we had a rehab session, Jenny would increase the goals just a little bit to make me work a little bit harder, and so each and every time that we went back we saw improvement. And of course that's the key. That's what we tell our football guys, is that every day you try to get a little bit better. And so every time we went to cardiac rehab, we got a little bit better. Right now we have kind of shut the rehab down in lieu of doing some chemotherapy. The two don't mix very well together. and we're kind of saving those for later on when I will definitely need some more rehab, and those people will. I know that it's going to be great. I know that they're going to do a great job and be ready for me and give me some goals, and they're probably going to start out with a bowl of Jello, but they have worked wonders, just worked wonders, and with the rehab program out here at Myrtue, and Jenny and Tammy have just done great jobs with that, scheduling and rescheduling and making sure that I get there when I need to get there, and I'm able to get to football practice, and I'm able to do all these other things that are, trying to keep the status quo going as much as possible.
I truly believe that preventive medicine, on coming in on a routine basis and knowing what your blood pressure is, knowing what your blood sugars are doing, and knowing what your LDL cholesterol is the key for prevention. It's important for patients to talk with their provider at a young age, including age 20 and up, regarding their risk factors. The modifiable factors include smoking risk, obesity, stress, lack of exercise, hypertension, which is modifiable, diabetes is modifiable, as well as high cholesterol.
Okay, good evening everyone. I hope everyone's having a good day, enjoying the game. I'm Dr. Smair from CHI Healthcare University Medical Center. I come here to Hardin 3 to 4 times a month, and a few of my associates, Dr. Ala, Dr. Dilkor, and Dr. Corollo comes here as well. We're here twice a week, and we help patients with heart disease and give a good advice about healthy lifestyle, exercising, eating healthy. We take care of patients with coronary artery disease, hypertension, atrial fibrillation, and high cholesterol level. I hope everyone having a healthy lifestyle, and I hope you're having fun enjoying the game. And have a good night.
Hi, my name is Tom Brandt. I'm a cardiologist from Methodist Jenny Edmondson Hospital in Council Bluffs, Iowa. I've been coming out to do the Harlan clinics now for about 5 years. We see a broad range of patients, young and old. We treat heart failure, heart attacks, chest pain evaluations, heartbeat irregularities, the whole gamut of cardiovascular disease. Our focus tends to be on adult cardiology. We try and do whatever we can to keep things local here. We have a wide array of testing that we do, echoes, stress testing. We can do pacer checks and all that, with the philosophy that what can be done local stays local. Enjoy the facilities here. We have a wonderful staff. Go Cyclones.
Well, the support system, for me, was one of the most important things. If somebody has cancer, that basically the whole family does, and they're all battling it, and the recourses that come from it. And I would say that that's probably true as well with heart disease and having to do lots of things to get back on track and get back to a healthy state. And that relies a lot on your spouse or family members around you. And I have great assistance there to make sure that I had what I needed in order to get better. And we are in the process of doing that and getting better. So that works out.
I truly believe at a young age, starting at age 20, every person should have a baseline lipid profile to determine their cardiovascular risk factors. They need to be assessed regarding their eating habits, their smoking habits, and their exercise habits at a young age. It starts in the family at a very young age, knowing what your risk factors are, knowing who your family members are who have had past events, and reducing that starting now. With that being said, I encourage you all to look at yourself in the mirror, look at your risk factors, write them down, write your concerns down, know your family history, and get in and be seen and talk with your doctor now. Go Cyclones!